Have you ever wondered who invented plastic surgery? Most people imagine Hollywood, celebrity makeovers, or modern hospitals filled with advanced technology. But the truth is far more surprising. Plastic surgery is older than the Roman Empire, older than Christianity. In fact, its story begins more than 2,500 years ago, and it didn't begin with beauty. It began with survival. Imagine losing your nose, not in an accident, not in war, but as a punishment. In ancient India, cutting off a person's nose was one of the harshest penalties for crimes such as theft or adultery. It wasn't simply a physical injury, it was a permanent mark of shame. A face without a nose meant losing your identity, your dignity, and often your place in society. People weren't just trying to heal, they were trying to become recognizable again. Around 600 BC, a physician named Sushruta changed history. Today, he is often called the father of surgery. But his greatest achievement wasn't inventing a miracle overnight. It was treating surgery as something that could be taught, practiced, and improved. His medical text, the Sushruta Samhita, described hundreds of surgical procedures and dozens of specialized instruments. Among them was one remarkable technique. To rebuild a missing nose, Sushruta carefully transferred living skin from the patient's forehead or cheek, keeping part of the tissue attached so blood could continue flowing until the new nose healed. The idea sounds astonishingly modern, because in many ways, it was. Even today, forehead flap reconstruction remains one of the most reliable techniques for rebuilding severely damaged noses. More than 2,000 years later, surgeons still use the same biological principle. That alone tells you just how extraordinary Sushruta's work really was. Elsewhere, ancient physicians also attempted to repair damaged faces. Roman writer and physician Aulus Celsus described methods for repairing injuries to the nose, ears, and lips during the 1st century. But after the fall of Rome, much of Europe entered centuries of political instability. Medical knowledge survived, yet progress slowed dramatically. For generations, people who suffered severe facial injuries often had little hope of restoration. A damaged face remained damaged for life. Then, after nearly 1,000 years, plastic surgery returned. Not through war, not through science, but through the Renaissance. The Renaissance is usually remembered for breathtaking paintings, magnificent sculptures, and revolutionary ideas. But it also revived human anatomy. Artists wanted to understand the human body. So did surgeons. In 1597, an Italian surgeon named Gaspare Tagliacozzi published one of the most influential medical books of his time. Its title was long and difficult, but its message was simple. A damaged face could be rebuilt. Tagliacozzi developed a remarkable technique for reconstructing noses using skin from the patient's upper arm. The procedure was anything but comfortable. For weeks, sometimes even longer, the patient's arm had to remain strapped to the face while new blood vessels slowly formed. Imagine walking through town, unable to move your arm away from your own face, painful, awkward, and incredibly slow. Yet for someone who had lost a nose, it was life-changing. Tagliacozzi understood something that many physicians of his time did not. He believed surgery wasn't only about saving lives, it was also about restoring confidence. As he famously wrote, "We restore, rebuild, and make whole those parts which nature has given, but fortune has taken away." Centuries later, those words still describe the heart of reconstructive surgery. Yet despite these remarkable breakthroughs, plastic surgery still faced one enormous problem. Surgeons had ideas, patients had hope, but medicine itself wasn't ready. Imagine undergoing facial reconstruction with no anesthesia. Every cut, every stitch, every minute, fully awake. Even if a patient survived the pain, another enemy waited: infection. Before modern antiseptic techniques, even a successful operation could become fatal within days. The greatest obstacle wasn't skill. It was simply keeping patients alive long enough to heal. Everything changed during the 19th century. First came anesthesia. For the first time, surgeons could perform long, delicate operations without unbearable suffering. Then came antiseptic surgery. Clean instruments, disinfected wounds, far fewer infections. Suddenly, procedures that once seemed impossible became realistic. One surgeon quickly recognized the opportunity: Joseph Constantine Carpew. Inspired by descriptions of ancient Indian surgical techniques, Carpew successfully performed nasal reconstruction in England during the early 19th century. His work reintroduced one of history's oldest reconstructive methods into modern European medicine. It was more than a successful operation. It was proof that ancient knowledge and modern science could work together. Plastic surgery was no longer a forgotten curiosity. It was becoming a true medical specialty. But no one could have imagined what would happen next. Because the greatest advances in plastic surgery would not come from hospitals. They would come from battlefields. The First World War introduced weapons unlike anything the world had seen before: machine guns, high-explosive artillery, shrapnel, poison gas. For the first time in history, thousands of soldiers survived devastating facial injuries that would have been fatal in earlier wars. They came home alive, but many no longer recognized the person staring back from the mirror, and neither did their families. Plastic surgery was about to face its greatest challenge and its greatest transformation. That transformation began with a problem medicine had never faced before. For centuries, reconstructive surgery had focused mainly on individual injuries: a missing nose, a damaged ear, a wounded lip. But World War I created thousands of complex facial injuries at once. Entire sections of the face had to be rebuilt, and many patients needed not one operation, but dozens. Plastic surgery could no longer depend on isolated surgeons performing rare procedures. It needed specialized hospitals, dedicated medical teams, new techniques, and an entirely new understanding of the human face. The man who helped bring these pieces together was Sir Harold Gillies. Today, he is widely remembered as the father of modern plastic surgery. But Gillies wasn't trying to create perfect faces. He was trying to help wounded men eat, speak, express emotion, and return to society. In 1917, a specialized facial reconstruction center opened under his leadership at Queen's Hospital in Sidcup, England. There, surgeons worked alongside dentists, artists, and other specialists. Together, they treated more than 5,000 servicemen through over 11,000 operations. This was the real transformation. Plastic surgery was no longer a collection of rare techniques. It was becoming an organized medical specialty. Gillies and his team refined skin grafts, rebuilt damaged jaws, and developed new ways to move living tissue across the body. One important innovation was the tubed pedicle flap. A strip of skin remained connected to its blood supply, but was rolled into a tube to protect the living tissue. Over several operations, it could gradually be moved toward the damaged area. The process was slow, but before modern antibiotics, it gave the tissue a much better chance of surviving. One of Gillies' best-known patients was Walter Yeo, a sailor severely injured during the Battle of Jutland. The reconstruction could not erase every scar, but perfection was never the goal. The goal was to restore function, identity, and the courage to be seen again. Then, just over 20 years later, World War II forced plastic surgery to evolve once more. At Queen Victoria Hospital, surgeon Archibald Mackindoe treated airmen with devastating burns. His patients became known as the Guinea Pig Club because many of their treatments were still experimental. But Mackindoe understood that surgery alone was not enough. He encouraged his patients to leave the hospital, meet local families, visit restaurants, and return to everyday life. The surrounding community welcomed them, and East Grinstead became known as the town that did not stare. Mackindoe helped redefine recovery. Healing was not only about repairing damaged tissue, it was also about helping people belong again. After the war, techniques developed for soldiers began helping millions of civilians, burn survivors, children born with facial differences, people injured in accidents, and cancer patients needing reconstruction. But plastic surgery was also moving in a new direction. For thousands of years, patients had asked, "Can you rebuild what I have lost?" Now more people began asking, "Can you change what I already have?" Growing prosperity, Hollywood glamour, advertising, and changing ideals of beauty helped cosmetic surgery enter the mainstream. Rhinoplasty and facelifts became more refined. In 1962, the first silicone breast augmentation introduced a new era of body modification. Then liposuction transformed cosmetic surgery again. Instead of only removing or tightening skin, surgeons could sculpt the body's contours through small incisions. By the end of the 20th century, changing your appearance no longer always required surgery. Botulinum toxin could temporarily soften wrinkles. Fillers could restore volume. Lasers could change the surface of the skin. Beauty treatments became faster, less invasive, and increasingly part of everyday culture. Then came the internet, selfies, beauty filters, and social media. People were no longer comparing themselves only with celebrities. They were comparing their real faces with edited versions of themselves. Yet, behind the world of cosmetic beauty, reconstructive surgery continued making extraordinary advances. Microsurgery allowed doctors to reconnect blood vessels thinner than a strand of hair. Living skin, muscle, and bone could be moved from one part of the body to another. Then, in 2005, the world's first partial face transplant was performed in France. Plastic surgery had travelled an astonishing distance, from rebuilding a nose with forehead skin to transplanting complex facial tissue from a donor. Today, three-dimensional imaging helps surgeons plan operations with remarkable precision. New research in tissue engineering may one day allow damaged body parts to be regenerated. But as the possibilities expand, the oldest questions remain. What are we trying to restore? Function, identity, confidence, beauty, or an ideal that may change again tomorrow? Plastic surgery did not begin in Hollywood. It began with people trying to recover what injury, disease, punishment, or war had taken away. Over time, it learned not only to rebuild the human body, but to reshape it. And through every transformation, one purpose remained at its center, helping people feel at home in their own bodies again.